A program at the University of Illinois College of Veterinary Medicine is helping our four-legged friends with eye issues see again. Coming up on the Paw Report, we'll meet veterinary ophthalmologist Dr. Todd Marlo, who'll talk about the vision of this program and what it means for pet owners searching for help. Stay with us.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Thank you for joining us for this episode of the Paw Report, and we have a special guest joining us on this episode. In fact, it is his first episode on the Paw Report. We welcome to the program Dr. Todd Marlo, who will be talking about ophthalmology services at the University of Illinois Veterinary Teaching Hospital. Thank you. And I did kind of forget to introduce another little buddy that you have with us. This is Dr. Todd Marlo and
Odin.
Oh, well, thank you both for joining us. And we look forward to learning more about you and Odin and ophthalmology services at the University of Illinois. Thank you for joining us.
Absolutely. Thank you for inviting me out here today.
You bet. And the first question is always the easiest. It's tell us about Dr. Marlo and his journey to the University of Illinois.
Yeah, absolutely. So when I first grew up, I was down in Marion, Illinois, so in Southern Illinois, and then we went to undergraduate at Southern Illinois University. Came up to the University of Illinois for my veterinary school, graduated there around 2013, and then from there went on and did a small animal rotating internship at the University of Missouri, and then was able to stay on at the University of Missouri for a comparative ophthalmology residency. Following that, didn't come straight back into academia, went into private practice down in Chattanooga, Tennessee for 5 years, and then just came back to the University of Illinois in November of this prior year.
Odin decided he was going to take a break and go see his mama
He
off camera. But Odin is a golden retriever.
Odin's a golden retriever. He's 5 years old. He's going to be we'll do an examination later. I'll show you about with Odin because he's great. But yeah, he's 5 and he's our family pet. Excellent.
Well, some people out there may be saying, what is a veterinary ophthalmologist?
Yeah, and that's a great question. I mean, there's not a lot of us out there. There's only around 550 that practice in the United States. And so my coverage area here at the University of Illinois is pretty much the entire state except for Chicago. So what a veterinary ophthalmologist is like I stated before, I went on and did vet school following vet school. So I did another 4 years past vet school and just specialized at the eye. And so we treat a variety of different diseases and a variety of animal species, everything but a person, with all different eye diseases. And so that's all I do is ocular diseases. I don't spay and neuter your pet or anything like that, but I do cataract surgery and other things.
So why would my pet need to see a veterinary ophthalmologist? I mean, that just sounds so human when we're talking about ophthalmology.
Yeah, and the veterinary world in general has become much more specialized. So we don't only have just veterinary ophthalmologists, but we have veterinary cardiologists, veterinary dermatologists, all of which are uniquely at the University of Illinois. But throughout the country, there's a whole bunch of subspecialties that are now present. But the reason you would ever need to see a veterinary ophthalmologist is because maybe you're dealing with an animal and you're working with your local veterinarian, and for your dog, they just can't figure out what's going on, or they want to send it to an ophthalmologist for a specialist exam. Just like if you were dealing with your optometrist and maybe you have glaucoma or something, they may send you to a human ophthalmologist to get glaucoma surgery or anything done, and then you come back and check with your optometrist. The same way works in veterinary medicine. We work with your local veterinarian very closely. They may say, hey, you have cataracts, you need to be sent to the specialist to have that surgery, and then we can transfer you back to your local veterinarian. And so that's what we do as a veterinary ophthalmology team.
So is my pet's eyes much different than mine?
Yeah.
What is the natural makeup of your pet's eyes? And and I'll probably throw in another question.
Yeah.
Do most dogs just see black and white? I mean, that's kind of the thought out there.
Yeah, so that's a couple questions in one, so we'll kind of unpack that for you. So I guess your first question was, you're going back to pet colors and pet anatomy. So it depends on what your pet is. So if your pet is a dog or a cat, they resemble human anatomy pretty closely, but there's some subtle differences. But if your pet is a tortoise or if your pet's a fish, those are completely different than human anatomy. But in regards to, let's say, our canine patients and our humans, they are very closely, but some subtle differences. So one, the canine lens, which is where cataracts are much bigger than a human lens. So if you were to try to do canine cataract surgery by using human equipment, things wouldn't be long enough to actually reach the entire lens and to do that surgery properly. Additionally, you may hear, or maybe somebody in your family has macular degeneration. Well, that doesn't happen in canine and feline patients because they don't have macula. So we have diseases that are similar, but we have some subtle differences. Again, we have cornea, a pupil, lens, retina, all that is similar across a lot of species, but in our canine and feline patients, that's different. When we get into different things like snakes and stuff like that, they actually have different anatomy where they can have what's called a spectacle, so they have like a cornea or the clear part of the eye over top of another cornea, so they have unique anatomy there. I had to learn everything about octopuses and all sorts of stuff, so those are all very different than the normal mammalian eye. In regards to color vision, so us as humans, we actually have, and you may have heard about cells called rods and cones. Cones are the cells in our retina that are responsible for color vision. Dogs don't just see black and white. They actually see different shades, but they see dichromatic, so they only see two colors. Us as humans, we're trichromatic, so we actually see three different colors. And in using those three primary colors, if you remember back in kindergarten, you kind of put those colors overlapping, you can make a lot of other colors, versus a dog, if you only had two, you can't make quite as many colors. But it's not just black and white.
So the normal, when you look at let's say a dog, we'll just use that as an example. You know, the pupil, small or big, cornea, small or big, the whiteness of the eye, what does it look like? Yeah,
so when we look at a dog, and that's what most of our animals that we deal with are as dogs, that's probably about 70% of our caseload. Even when I was in private practice, that was about 70% of our caseload. So when you look at a dog, the white of the eye, the sclera, that we want to make sure that's all nice and white. That's a normal dog. The cornea, the clear part of the eye.
Let's get Odin over here.
Yeah, Odin, come on over here.
Come on, Odin. Come here.
Come here, Odin.
We're talking about you.
Come here, Odin. So yeah, so you can have your toy. So
there you go.
The white of the eye, when we look at and do an examination, which we'll do later, we kind of look all the way around. And so we look at the eyelids, we look at the white of the eye, we want them to be nice and white. We want the corneas to be clear. There's different corneal diseases that can cause decrease in clarity. And then we look at their pupil. Does their pupil move in and out? Just like when you go to your own doctor and you see them turn the light back and forth over you, track the light. So we do things like that to look at it.
What are some of the common problems that you treat? I know there's a laundry list, but let's go through some of those and maybe if you can define them.
Yeah, absolutely. So some of the problems that we treat, again, being in the canine eye, that would be the easiest, but we'll also talk about some feline issues as well. So the most common issue that we deal with is probably cataracts. So people bring in their dogs to deal with us because their dog is running into the wall or not catching the ball like it used to, not catching the treat, not being able to jump on the couch. And so cataracts cause blindness. And the cataracts that we deal with in veterinary medicine most closely resembles probably what human ophthalmologists would see in more of a third world country because they're going completely blind. People would go to a human ophthalmologist when they just can't read the paper as well. Luckily, our dogs don't read the paper, but it'd be really interesting if they did. But we're dealing with cataracts that take up much more of the lens. Other potential common issues that we deal with is glaucoma, or an increased pressure within the eye. Again, dealing with that in humans as well. We deal with retinal diseases that can cause blindness, similar to macular degeneration. And then finally, another common disease that we deal with is corneal ulcerations or corneal trauma to the eye, which is a wound to the front of the eye.
When you're talking about glaucoma and other issues, what is the issue when, because I had a pet that was like this, you look at the eye and they were really milky Is that a cataract, or would that be a sign of glaucoma? You know, it almost looked like literally somebody poured a little bit of milk in their eye.
Yeah, absolutely. So I will ask you this: was your dog a little older?
Yes.
Yes. So
yes.
So there's two different things, and we teach the veterinary students how to resemble that. So when you have just cloudiness to the lens, that can be an age-related change. Just like our lenses, we need to start getting reading glasses or bifocals. The same thing happens with our companion animals as they age. That's not a cataract, but a cataract would be that milkiness that you're probably describing is just the age-related change. A cataract normally appears as much more white, like a white piece of paper, is what you see, and they are completely blind. They run into walls and do everything.
Pink eye, cherry eye, conjunctivitis, all other problems. Can you talk about those?
Yeah, absolutely. So pink eye, the only disease that we have that closely resembles pink eye in veterinary medicine is actually, that's a viral disease in human medicine, but in veterinary medicine we actually deal with pink eye in cattle. So I have to learn how to treat pink eye in cattle, and then in veterinary medicine, some like conjunctivitis and stuff, there's different feline viruses that are infectious diseases that actually cause conjunctivitis or redness of the eye, and that's very common to see in kittens and different things.
What else causes problems with eyes? Is it hereditary? Is it diet? Is it trauma? Is it all of those things?
Yeah, so it's all of those things, and we can kind of unpack some of that. So overwhelmingly, the majority, I would say, of our diseases that we deal with in the eye are probably genetic. So there's different genetic causes of glaucoma. There's different genetic causes of retinal disease. There are different genetic causes of cataracts. So overwhelmingly, most are hereditary. But it's unique that you brought up diet. So there actually is, if we think about in cats, and you may have always heard, I remember growing up, don't feed cats dog food, things like that. It's because it truly can affect their eyes. And so if cats need a specific amino acid or a specific protein that's not found in dogs, because they can actually make it themselves. And if you don't feed them that, they actually get scars and their retina doesn't form appropriately. And then trauma is also a huge cause of what we see. So we see a lot of emergency cases for trauma. My favorite one was a dog attacked by a chicken. That was an interesting case, so had to suture that eye back together. So yeah, we see a lot of trauma cases out there too.
And then that can linger as, you know, the dog gets older and that sort of thing.
Absolutely, yeah.
What about eye allergies? Does that mimic something different than what we've talked about, or can some of the symptoms be the same? Is it completely different?
No, it can definitely. So the eye can only do a few things, and this is what I talk about owners. The eye can only get red, you can go blind, and it kind of turns blue. Those are pretty much what the eye does, and it's the job as an ophthalmologist to kind of weed through all of that and figure out the actual disease. But no, they definitely have allergies present, and those are present more so in what we call our brachycephalic or our bulldogs, Boston Terriers, things like that. So animals that have systemic environmental allergies, maybe every spring and fall, they really have bad allergies to pollen or whatever, they definitely can have that happen on their conjunctiva. The pink part around the eye can actually get pretty red, and they can have discharge and everything, just like we do.
It's interesting that you mentioned a couple of breeds, because that kind of launches into my next question about our certain eye problems specific to breeds. Is that even a thing?
Yep, absolutely. And that's a big job. If you want to become an ophthalmologist, when you do all of that additional schooling, you have to learn all of these different genes that we've actually been able to isolate in specific breeds that cause different issues. But yeah, I mean, for instance, the Cocker Spaniel, for instance, has primary glaucoma, or a genetic etiology of glaucoma that we know. In terriers, we know that there is a genetic etiology behind making their lens, where cataracts form, actually be able to move around inappropriately. So we've isolated that gene. There's different animals like the English Springer Spaniel that's known to have different genetic retinal diseases. So there's quite a few different genes that we've isolated, and there's a lot more genes that we haven't isolated, or that are kind of multifactorial, multigenetic, that we're doing a lot of research on to be able to find.
What about, we'll just pull out Odin, retrievers, you know, more of the sporty hunting dogs, the beagles, and I only say that there's a lot of people out there that have the labs and the doodles that are of that breed. Yeah,
so, you know, for instance, that's a great question. We do a lot as the ophthalmology community, to preference all this, we do a lot of work with eye examinations. We call them OFA examinations or care examinations, where you can go into a veterinary ophthalmologist, or I go to a lot of dog shows and actually do eye screenings to screen for these genetic diseases in show dogs and different things. Now in our retriever breeds, we know that they have genetic cataracts, so Labradors and Golden Retrievers are known to have that. Also, for instance, Goldens have a specific disease called Golden Retriever uveitis, or inflammation within the eye, that just affects Goldens. So those are kind of the more common diseases for those two types of dog breeds.
We're going to have to get Odin back over here because you brought some equipment with you. And my next question has to do with diagnosing. So I'm assuming that when, you know, a pet owner notices redness, maybe, you know, eyes that are watering a lot, and they just sense a problem, and they reach out to you, how do you go about finding out what the problem is?
Yeah, absolutely. So I'll tell you how it works at the University of Illinois and how it similarly worked when I was in private practice, and then we'll get Odin out here and actually do an examination with this. But whenever you come to the University of Illinois and you would work through ophthalmology, we would take you in, we would bring your dog actually to the ophthalmology section, and we do a series of 3 different tests. It's called our minimum ophthalmic database. So the first test that we do is called a Schirmer tear test. And with that, we actually take a little strip of paper and we put it on your dog's eye, and it measures your dog's tear values. We're checking for dry eye with that test. The second test that we do is similar in humans, where you may have got that puff of air when you go to an optometrist, or seen this like blue probe comb to your eye. It's checking for intraocular pressure. Well, we have a handheld way to do that. It's called a tonometer, and it sends this little probe and it bounces off the eye and it tells us what the pressure is within the eye. And then the third test that we do is where we actually place a dye, it's like a yellow-green dye, into the eye, and we're checking for abrasions or wounds to the eye. So every single dog gets that test done. Now following that, we do a couple different tests here, and we'll bring Odin out to show you. But this right here is called our slit lamp. So unfortunately, dogs and cats aren't good enough to be able to put their chin on something like that and hold it. Come here, Odin.
Come here, Odin.
Come here, come here, Odin. Come here, Odin.
Come on.
So they're not able to do that, or at least hold it there. So we have to be able to use something that's different, and this is our slit lamp. So what we're able to do is we actually can get up close and actually look and do the same thing that we're doing with this that you would see done when you put your chin in that at your optometrist.
Odin is perfect, but I bet you have some pets that just aren't so cooperative.
Oh, we do. Absolutely. We definitely have some pets that aren't perfect for sure. And, you know, in working in private practice and dealing with a lot of different police dogs that aren't always so nice, most of them are though, and dealing with just animals that are scared to be there because, you know, we're shining a bunch of lights in their eye. I've definitely gotten really quick at being able to do an exam and gather a lot of information, but we definitely try to make it as stress-free as possible anytime we go. The other thing that we do is we want to be able to look in the back of their eye. So if we diagnose retinal disease and different things, we do what's called fundoscopy. So for this, we actually place this over top, and then let me put this in right here. We actually use a lens, and we're able to actually look in the back of their eye by doing our examination just like this. And so what we're looking for when we do that, you may have seen like when you're driving and you see a deer and you see that kind of that blue-green reflection in their headlights.
Absolutely.
Absolutely. So we're using the same technique there. We're shining that light, and luckily they have a tapetum, which is what's reflecting that light, just like the deer, and we can use that lens and actually be able to identify different structures in their retina, make sure that their retina looks healthy, it's not detached, anything like that.
So once you do your testing and you compile all the information that you can on the client that you're seeing, treatment options, do they vary, or is it all medication? Can it be stuff that you do at home? Can it be change of diet? Is it a combination of all of that?
Yeah, so mostly not diet. So that's a big misconception, at least in my way. Unless you're dealing with that specific feline disease, diet's pretty inconclusive in that. It doesn't really change much. But what I always like to break it down is I just want to work with owners. So for instance, in cataract surgery, which is again the most common thing that we do, I really work with owners and give them several different options, because my job as an ophthalmologist is to, one, try to make your dog visual again, but ultimately I want your dog to be comfortable. And there are some eye diseases that aren't comfortable. So I work with them and I go through, say, here's what cataract surgery is, here's how much it would cost, and if owners aren't able to afford cataract surgery, which is okay, we work with them, and I just want to make sure your dog stays comfortable. So we start a topical medication just to prevent things like glaucoma from developing and other things. Because I want to work with owners, and I hope they're honest with me. You know, not everybody can financially afford every surgery, but they still want to take care of their dog. And because they're at an ophthalmologist, you know they really want to take care of their dog. And so I just work with them to find the best method for both them and their dog, given financial limitations and given what they can actually do, because some dogs don't like eye drops. They may bite me when I try to do the exam. They also may bite the owners. And so we have to work together to try to find the best solution for them.
I fear, and I'm speaking as me, the pet owner, that my pet could go blind.
Yeah.
You know, I mean, it's scary to think about cataracts and conjunctivitis and anything else that could go wrong. How do you comfort somebody that comes in and that's their question? You know, after you've explained everything to them, the bottom line is my dog going to go blind?
Yeah, well, absolutely. Kind of getting back to those two core principles of my whole job, vision and comfort. And so if we've lost vision, we have to restore comfort, and that could be through a couple things. And the way I talk with owners, there's a lot of different diseases that may cause vision loss, but they're non-painful. So things like retinal detachment, your dog doesn't affect pain, and they can still have good qualities of life. And so we try to go through different ways that you can sit different areas of your house, so a blind dog may be able to learn your house much quicker, just like a blind person can learn their house. I mean, it's not great. Believe me, if I could make every single dog visual and have this great life, I absolutely would, but it's just not possible. And I was just dealing with a dog yesterday that unfortunately was blind, and blind very quickly, and was very painful. And so we were trying to work through medications to at least make sure that that dog stayed comfortable, and we're going to reevaluate and see where we are with that dog. But ultimately, sometimes we can't restore vision and sometimes we can't restore comfort, and in those cases, it is okay to remove an eye eventually too, because if your eye is not going to ever be visual and it's only a source of pain, the best thing for you is, in order to do at that point in time, is probably remove it. It's not what we want, believe me, it's not what we want, but sometimes it's the best thing to do.
Besides moving things in your home to make it more comfortable for a dog that may have vision issues, what are some other at-home routines that I can get into? I think a common question is, well, can I use my human eye drops for my pet?
Yeah, and you can. So all of our veterinary medicine, there's very few that are actually specific veterinary drugs. Most of the drugs that we utilize, we can call into different pharmacies and stuff like that. They're all commercially available. You can use the same eye drops, like if you use a topical lubricating drop or if you use an artificial tear for your own eyes, you can use normally that same brand on your pets, as long as it's not something that says gets the red out. There's a couple products out there that say get the red out. You don't want to use those. And I would also caution you to not use the same bottle on your eyes as you would on your pet's eyes. We don't want any cross-contamination there. But you definitely can. I mean, I know I prescribe sometimes several different medications, and I tell them to go to your local pharmacy, find a lubricating eye drop, and you apply that a couple times a day to really help with some of these dogs that may have dry eye or different things like that. And then different ways around their house with blind dogs. You just really need to make sure, do you have a pond or a pool? You need to really guard them from being able to get into a water if they're blind, because if they were to get in there, that could be a life-threatening issue. And then doing things like baby gates and stuff like that.
Dr. Marlo, we have a couple minutes left, and I'd like to know some other services that your actual department, the ophthalmology department at the University of Illinois, provides to people that maybe they're watching and they're not sure if you would be the right department to call if they notice a problem. Yeah,
absolutely. So we deal with, first of all, we deal with every single animal species but a person. So anything but a person we will take care of.
And have you had some wild ones?
We have. So I've had to work on elephants, I've had to work on otters, I had to work on geckos. I mean, we have to work on everything. And that's the challenge as a veterinary ophthalmologist. You have to know everything about every single eye except for a person. So in a way, that's a little easier. But so different things. So if you're dealing with a dog that has squinting or has ocular discharge, we would be the place to go to. If you're dealing, or any animal, if you're dealing with an animal that has vision loss, we would be the place to go to. Or sometimes if you're dealing with dogs that have, you don't know if this is maybe a neurological issue, they're seeming like they're a little off, suddenly not being able to see. We work with neurology very closely, and so sometimes it's really hard as an owner to figure out well, are we dealing with something that's going on in his brain, or is he just not seeing, and that's causing this new abnormal behavior? And so sometimes you send them to us and we may transfer them to neurology, and the same way goes back and forth. So it's hard to tell you, in this program where to go, but I think ophthalmology is a good place if you have abnormal behavior, vision issues, anything like that.
Okay, so I have to ask,
Yeah.
you worked on an elephant?
I did work on an elephant.
What in the world did you do?
Yeah, so the elephant actually had cataracts, and so we had to, it was the craziest experience ever. I always will remember it, but I had to be up on a ladder looking at this elephant's eye. It was like entering Jurassic Park, I felt like, in the elephant holding facility.
Course.
But yeah, I was up on a ladder working on an elephant's eye. He was darted, so he was under some anesthesia. It was really cool too, because the elephant had a brain tumor, so you couldn't give him too much drug. So we were working on quite a few different things. But yeah, it was really interesting, really, really cool. It had a great success for it. But yeah, some of those unique exotic animals, it's not only having the ability to diagnose, but also having the ability to treat. But luckily, we were able to make a good treatment on that elephant.
A great story, and
Yeah.
what a way to end a phenomenal Paw Report segment with a first-time guest,
absolutely.
Dr. Todd Marlo from the University of Illinois, and Odin, who's over with Mama right now, just relaxing. Thank you for joining us and enlightening us on the ophthalmology world of veterinary medicine. So thank you for joining us. And of course, we want to thank our viewers of the Paw Report for joining us for this episode of the Paw Report. Until next time, I'm your host, Kelly Goodwin.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.